Hello, I am Derica Barnes, and I'm working alongside Casey Davis, Hunter Grimes, and Chelsea Wynn for our nursing theory presentation. The nurse that we chose as our theorist is Virginia Henderson. So who is Virginia Henderson? Virginia Henderson was born in 1896 in Missouri. She earned her nursing diploma in 1924 from the Army School of Nursing. New York is where she worked at various hospitals up until 1924. Then in 1924, she decided to become a teacher at Norfolk Presbyterian Hospital School of Nursing. She then furthered her education and earned her master's in nursing from Columbia University in 1934. She believed that the goal of nursing was to enable the patient, or to attain or maintain a healthy state of mind and body, or where a return to health is not possible, the relief of pain and discomfort. She stressed the importance of clinical evidence and research. She was very research heavy. She studied a lot. She also emphasized a more holistic definition towards a nurse's role in helping a patient perform basic daily activities. So like walking, cleaning, drinking, stuff like that. She believed that a nurse's job is to help patients gain independence as rapidly as possible and preach the importance of patient-centered care. She was able to write down and teach her ideas in a concise, professional way. Because of that, her teachings became very popular, especially in the 70s. She contributed 5 books to nursing. Virginia Henderson's impact on nursing. Virginia Henderson was a renowned nurse, known not only for her time practicing and teaching, but also her long-standing theories in the practice of nursing. Henderson's need theory, along with her definition of nursing, earned her the title as the First Lady of Nursing. The need theory, also known as the 14 components of nursing, is one of Henderson's works that is still being implemented to this day. So here are a couple highlights about her theory. It was centered around the nursing practice. It was influenced by her personal work, so when she would go around and do her little studies and her teachings and her different little projects, and she did that a lot. It spotlighted the basic needs for a patient, so the physiological needs and so on. And then it worked to increase patient independence throughout the recovery process. So she really, really cared about, if possible, making her patients be able to support themselves.
All right, so my name is Hunter Grimes, and I'm going to be talking about the 14 components of the basic nursing care, or the need theory in a sense. It was, so number 1 is breathe normally. You want to be able to have a normal breathing and regular rhythm. You don't want it to be irregular. 2, you want to eat and drink adequately, and eliminate bodily waste. These two go hand in hand together, because 1, you want to consume energy for your body, and then 2, you want to eliminate the energy that's not being used, and then 4, you want to move and maintain desirable posture. This is also tying in as well, because you want to take the first 2 to be able to use that energy to move and maintain posture, and then you don't want to sit still, because you could possibly create pressure injuries in a sense. And then 5, you want to sleep and rest. This is also going to help you with your energy. It's going to give you ability to be able to regenerate your energy. And then 6, you want to select suitable clothes, dress/undress, which this is talking about is not necessarily when you're going outside and it's cold, you want to have pants and long sleeve or a jacket on rather than shorts and a t-shirt. And then 7, maintain body temperature. So say it's hot out, you're going to go somewhere to cool off rather than just getting overly heated and possibly passing out, or it being too cold and you may get hypothermia in a sense. And then 8, you want to keep body clean and groomed. You don't want to be not have good hygiene in a sense, because without good hygiene, you'll probably give your body a chance to produce bad bacteria, or even have a chance to increase infection. And then 9, you want to avoid environmental dangers and injuring to others. As a nurse, you don't want to go in a sense in a client's room or a patient's room and you're endangering them or injuring them in a sense. You want to have a good variety and understanding of what to do and what not to do. And then 10, you want to communicate with others. So you want to communicate with your team. You want to communicate with the health provider in a sense. You don't want to sit there and not communicate with them, because nursing, that's what it's all about. You want to be able to communicate with everybody so you can learn and gain from everybody. 11, worship according to one's faith. You don't want to go into a room judging somebody's faith on saying they're Christian and they're not actually Christian. They may have another belief in a sense, and you're just trying to pressure them into it, or even making them feel uncomfortable about it. And then 12, you want to work towards a sense of accomplishment. You don't want to start at not having a goal. This is where you want to set your goal and have it to where you can actually go to it and maintain it, or actually get to it. 13, you want to play and participate in recreational activities. This is just like, you want to be with your community, be around your community. You don't want to just go to your job, get there, don't talk to anybody, don't communicate with them or anything. Just, you go to your job and you leave. Rather, you want to be able to communicate and create you basically a family with there at your job. And then 14, you want to learn, discover, or satisfy natural curiosity. So what this is saying is, like, basically you want your patient and yourself to be able to go beyond the parameters of what basically the basics are. You want them to be curious about what's going on. You don't want them to not just sit there and dwell on it, because everybody's curious, everybody wants to learn. So where do these concepts fall in the nursing meta paradigm? Person, environment, health, and nursing, all these are like tagging into one. So like the nursing practice, like most other industries, contain multiple working parts. The nursing paradigm allows these parts to be arranged into separate domains. Even though these domains are separate, they all operate interchangeably. Henderson's 14 components possess this same interchangeability, and they can easily be classified into multiple domains.
Hey, my name is Casey Davis, and today I'm going to be talking about the last two concepts of the nursing meta paradigm that you can apply Henderson's 14 concepts of nursing to. So first we have health. Health is defined very different by different people, and it's really individualized. So the health of one individual might be slightly different than a different individual. But health in general involves nearly all 14 of these concepts, and you could pretty much categorize all of them into health, and the same with our other categories. However, health has just a few of them that are really specific to physiological needs in this situation. So in our case, we have breathe normally, eat and drink adequately, eliminate bodily waste, move and maintain desirable posture, and sleep and rest. And as you can see, all of these are necessary to function. So there are some things not included on this list that are essential to health, and as I said earlier, it really differs based on the individual. In this situation, you could have things up here like someone's mental health, someone's ability to function in a social setting, things of that nature would all apply to the health category. In Henderson's case, she's talking of caring of things for the health category, and when your patient can't do it, that you do it for them. So in all of these situations, like breathing normally, eating and drinking adequately, and the following, if you enter a hospital situation and your patient cannot do these things, then that is your nursing intervention to go into it. And the same would apply to things that you don't see up here, like mental health and social abilities and things of that nature. Finally, we will be talking about the last concept of the nursing meta paradigm, and this will be nursing itself. In relation to Henderson's 14 concepts and her theory in general, the nursing domain includes all 14 of those concepts and so much more. In this situation, when you're using the nursing practice and you're implementing the nursing domain of the meta paradigm, then you are assisting your patients. Well, Henderson's theory is that you need to assist patients when they cannot accomplish any of these 14 components of health. So For example, if a patient comes in and they are unable to breathe or they're unable to receive adequate nutrients, it would be the nurse's role following the nursing process to provide the patient with the ability to complete these components. Along with components like those physiological ones, this would also apply to many other things. So if your patient comes in and they're struggling with a mental issue, then you would be sure to care for them and help them reach optimum health in that area of their life. And the same thing would be for socially and economically and things of that nature, anything that you can really do. The nursing aspect of the meta paradigm also really ties in the nursing theory of everyone, of every nurse that is practicing, because Henderson's theory has the goal of providing comfort and care to all patients and helping them reach the highest level of independence that they can. And as nurses, we should all have the theory and the want to and the drive to help our patients reach optimum health and help them be able to maintain that in their own home without us present. So overall, Henderson's theory should apply to every nurse that is practicing and hopefully does.
I'm Chelsea Nguyen, and the next thing I will talk about is person. As nurses, we will work in a fast-paced environment and we will meet hundreds of people every single day. So every one of them will have their own unique story and experience. So we will have the responsibility to treat them with compassionate care and with respect. When it comes to dressing and undressing, selecting clothes, we should help the patients to maintain their comfort and dignity. As nurses, we ensure that patients have the appropriate clothes. For example, if it's winter cold, then we will put long sleeve shirt on them or putting socks on them. And even though we want patients to move by themselves as much as possible, we can help them to dress when they're unable to do it. So keeping the body clean is also really important because we help the patients to maintain their cleanliness and to prevent infections. For example, we should help them with bed pay or oral care and to groom to maintain their wellness. So the component of work shaping according to the patient's belief is also important. It recognizes the significance of spiritual and religious aspect of a person's life. We should be respect and support the patients to practice their beliefs and provide them an environment that allows them to practice their religions. And working toward a sense of accomplishments is all about empowering the patients to set goals and achievements. We should encourage the patients to do the activities that bring them joy, or they feel a sense of fulfillment or a sense of purpose. This will contribute to their overall well-being. So lastly, the component of learning, discovering, and satisfying a natural curiosity will encourage the patients to engage in activities or hobbies that they interest in. As nurses, we should support the patients to find educational resources to help them engage in their hobbies and satisfying their curiosity about the world around them. And that's all I have for persons. So taking care of a person is important, but their environment is also as important. So in terms of environment, we should try to create a safe and risk-free environment for our patients, or we identify any potential risks or dangers that will put our patients or others or ourselves in harm. We should avoid risk as much as possible. And communication. This is another really important aspect of nursing care. It is also important in any professions. As nurses, we should making sure that communication between patients, their families, and our healthcare providers clear. Make sure that everybody is on the same page. Because Miss Henderson went to an army nursing school, even though she's not military personnel, but she went to an army school that have a custom and courtesy that value communications. So I think that's where she come up with communication as one of her 14 important components in nursing. And to maintain a body temperature is also an important thing for our patients, because so as nurses, we should monitor and regulate the body temperature through different ways. For example, when we bathe a patient, like this picture right here, we will cover where we don't touch just yet to keep their body warm, and just open the area where we're cleaning. And also we can adjust the room temperature because it will keep the patient warm. So keeping their body temperature will make sure that the patient is comfort and maintain their well-being. And recreation activities. This plays a role in promoting physical and mental wellness. So we should encourage our patients to engage in activities that they enjoy, because this can contribute to their overall happiness and their quality of life.